You know that tiny plastic tube they put in your arm at the hospital? Ever really thought about it? Well, it's called an IV cannula. And honestly, while it looks pretty simple, it's one of the most important life-saving tools in all of modern medicine. So let's get into it and really demystify this small but mighty device.
Right. This is a sight most of us have seen, maybe even experienced. And yeah, it can look a little intense. But this one procedure is literally the gateway for so much of what happens in a hospital, from critical medications and fluids to blood transfusions. And it does all that while saving patients from the pain of getting poked with a needle over and over again.
So, what's the big deal? Why is this little tube so unbelievably important? How does it even work? And what does it really take for a doctor or nurse to get it right every single time? Well, that's what we're here to figure out. We're going to break down the whole process, from the colorful codes to the correct way to take it out. Okay, here's our game plan. We'll start with the basics. What is a cannula? Then we'll crack the color code, and trust me, it's super important. After that, we'll dive into the practical stuff, how to pick the right spot, the step-by-step for getting it in, and finally how to take care of it and remove it safely.
All right, let's start at the very beginning. What is this thing, and what is its main job in medicine?
So, at its heart, an IV cannula is just a thin, flexible plastic tube that's carefully placed inside a vein. Its whole purpose is to create a direct highway into your bloodstream. This makes it incredibly efficient for giving things like fluids when you're dehydrated, life-saving drugs, or blood. And, maybe just as important, it saves a patient from the pain of repeated injections. I mean, one tiny cannula is way better than 5 or 6 separate needles, right?
Now let's get to one of the coolest parts about cannulas, the colors. This is not just for show, it's actually a brilliant safety system that everyone in the medical field understands instantly. You'll see cannulas in a whole rainbow of colors, and every single color means something specific. It tells you the size of the cannula, which in turn tells you how fast fluid can flow through it. This system lets a healthcare professional grab the exact right tool for the job in a split second, whether they're treating a tiny newborn or handling a major trauma case in the ER.
So let's break this code down. Think of it like this. The big guns are orange and gray. They're huge and let you push fluids in super fast, which is exactly what you need in a trauma situation. Green is also for serious business, like major surgery. Now, the one you'll probably see the most is pink. It's the workhorse, perfect for general fluids and meds. Then you get down to the smaller ones, blue and yellow, which are ideal for kids or adults who have smaller, more delicate veins.
Now, this is the one part that might seem a little backward, but it's absolutely crucial to remember. With cannulas, the smaller the gauge number, the bigger the actual tube is. So a 14 gauge is a massive cannula for emergencies, while a tiny 24 gauge is for an infant. It's an inverse relationship, and getting it right is non-negotiable in medicine.
Okay, so knowing the colors is half the battle. The other half is figuring out exactly where to put the cannula. And that means you have to know a little something about our body's plumbing. This is exactly why we aim for veins, not arteries. Veins are just perfect for the job. They're closer to the surface of the skin, they have thinner walls, and the blood inside is under low pressure. Arteries, on the other hand, are the total opposite. They're buried deep, they're thick, and they're under super high pressure. Accidentally hitting an artery is a big problem, which is why telling the two apart is one of the first things you learn.
So, how do you find that perfect vein? Well, it's actually more about touch than it is about sight. You're looking for a vein that feels soft and has a little bounce to it when you press down. You also want one that's relatively straight and, importantly, doesn't run away when you touch it. Developing that feel for a good vein is a real skill that takes a ton of practice.
All right, we've picked our cannula, we've found the perfect vein. Now it's time for the procedure itself. Let's walk through how it's done step by step.
First things first, you get your gear. Everything has to be sterile and laid out, ready to go. You need your gloves, a tourniquet to make that vein pop up nicely, the right size cannula, of course, alcohol swabs to clean the skin, tape to hold it all in place, and a bit of saline to make sure it's working correctly at the end.
The whole process is like a carefully choreographed dance. After prep, you clean the site, the needle goes in with the sharp, angled tip, the bevel, facing up at a pretty shallow angle. And then you watch for the magic moment, the flashback. That's a tiny bit of blood that flows back into the cannula, and it's the beautiful visual confirmation that you're in the vein. Once you see that, you gently push the plastic tube in while pulling the needle out. Then you release the tourniquet, secure it with tape, and flush it with a little saline just to be 100% sure it's good to go.
Okay, the cannula's in, but the job's not over. Taking care of it properly is so important to prevent any problems, and knowing when to take it out is just as critical as knowing how to put it in.
The general rule of thumb here is 3 days. A cannula really shouldn't be left in the same spot for more than about 72 hours. Why? Well, it's all about reducing the risk of infection and irritation to the vein. If the patient still needs an IV after 3 days, the best practice is to remove it and put a new one in a different location.
And this is information for everybody, whether you're the patient or the provider. You need to keep an eye out for signs of a common complication with a long name, thrombophlebitis. It's basically just a fancy way of saying the vein is inflamed. So if you start to see the area getting red, swollen, or painful, that cannula needs to come out right away.
I really want to end with this quote from our source material because it's just so true. Putting in a cannula is a learned skill. It takes practice, it takes patience, and it takes confidence. And here's the thing. Even the most experienced pros miss sometimes. The trick is to just learn from it, stay confident, and keep practicing.
And that really leaves us with something to think about, doesn't it? The IV cannula is such a simple-looking device, but the skill behind using it correctly saves lives every single day. It kind of makes you wonder, what other simple medical skills are out there, quietly making a huge difference in people's lives?